Hi there, I'm Renee Zuniga. I'm a lactation consultant with Simply Fed. Finding your flow in the early days, quite literally, means establishing and maintaining your breast milk supply. This is the foundation of all things feeding. We know that this can be a stressful and sleep-deprived time. So we're here to talk about what to expect during the first hours, days, and weeks as your milk comes in. How often to feed baby, how much and for how long, and how to know if your baby is getting enough milk. Before we get started, let's talk about what establishing supply really means. Many breastfeeding parents don't realize that it could take between 4 and 6 weeks to establish their full milk supply. This is because your breasts are wired to adjust to your baby's demands. In other words, milk-making hormones are directly linked to your infant's feeding patterns. When milk is removed by your baby or pump, your body responds by producing more milk. The more milk is removed, the more milk your body is told to make. This is how supply is established. The short answer? Skin to skin. In the hour immediately following birth, any time that babies are both skin to skin and connecting their mouths to their birthing parent's nipple is shown to promote breastfeeding. This is called the golden hour. Even though that first hour is important, the goal is really to do skin to skin as much as possible in the first few days of their life. There are so many benefits. Skin to skin stimulates baby's digestion and interest in feeding, supporting a good latch. It regulates baby's heart rate, breathing, and temperature. It stimulates the release of hormones to encourage breastfeeding. And it can help prevent infection by introducing baby to mom's normal bacteria. Your baby doesn't need to have a strong or successful latch right away in order for skin to skin to be beneficial. If you need to, you can express colostrum by hand while they lick to start getting them interested in latching and provide some nourishment. Colostrum is the thick yellow milk that you begin producing in pregnancy. It's waiting for your baby to arrive. Around your baby's 5th day of life, this colostrum will become transitional milk, which is thinner and can be a whitish, bluish, or grayish in color. Some colostrum will still be present. Once you reach about 2 weeks postpartum, your mature milk will have come in. If your baby is in the NICU or you're unable to do skin to skin for some reason, try to keep calm. While it's true that skin to skin promotes breastfeeding, there are ways to mimic your baby's presence. For example, you can try smelling the hat your baby wore just after birth, or pumping while at the baby's bedside to encourage letdown. Most importantly, give yourself some grace. While it's true that those early days are important, they are not everything. It's common for your baby to sleep a ton in the first 24 hours of life. If they're not waking up to feed on their own, try changing their diaper or placing them skin to skin to wake them. On day 2 of life, they may all of a sudden be fussier. This doesn't necessarily mean that there's a problem with your milk supply. It just means that they've woken up and will want to be at the breast or bottle often. As for how often, you should feed your baby as much as he or she would like. On average, that'll shake out to about 8 to 12 times within a 24-hour period. If you've gone longer than 2 to 3 hours without feeding, wake them gently. You should continue to feed your baby on demand, between 8 and 12 times per day or every 2 to 3 hours for the first month or so. Their stomachs are small, so they can only take in so much at once and need to eat often. The time between feedings is measured at the start time of the feeding. For example, if you feed your baby at noon for 30 minutes, the next time your baby might feed is at 2 p.m., 2 hours later. It's especially important to feed overnight in the early days, as this is when your body actually produces the most of your milk-making hormone. You shouldn't worry about overfeeding them. If they're showing a hunger cue, they're hungry. At birth, your baby's stomach is about the size of a cherry. By week 4, it's still small, usually no bigger than an egg. The good news is that this frequent responsive feeding, exhausting as it may be, will help to stimulate your supply. Schedules can be helpful for parents and caregivers, but you don't need one. By feeding on demand, you're allowing your baby to tell your breast how much milk to make. Again, that's the secret to establishing supply. That said, you can definitely start to work towards a schedule once breastfeeding has been established. There's no hard and fast number here. Trust your baby and let them tell you when they're finished. They will usually feed for longer on the first side and spend less time on that second breast. Sometimes they may not need the second side at all. You can think of it this way. The first side is dinner and the second side is an optional dessert. Just remember to offer the dessert side first during your next feed. What's important is that you let baby finish feeding on one side before offering the other breast. You'll know when they're done because they'll pop off the breast or fall asleep. Switching them too soon could result in decreased supply. And don't be afraid to ask for help. If your feeding sessions are lasting for more than an hour, you should talk to your baby's healthcare provider. In the first few weeks of life and later on, as your baby goes through growth spurts, they may suddenly need to eat more than normal. This is called cluster feeding. Cluster feeding is when your baby has multiple short feeds over a span of a few hours. This is most common in late afternoon or early evening, and this usually lasts for a few days. If it lasts much longer, then you should consult your baby's healthcare provider. If you're breastfeeding, cluster feeding will prompt you to make more milk. Follow their cues and remember that this is normal and doesn't mean that you're not making enough milk. There are two signs that your baby is getting enough: weight gain and wet diapers. First, let's talk about weight gain. It's normal for your baby to lose between 5 and 10% of their birth weight in the first couple of days following birth. Once your milk comes in, they'll start gaining weight again. The goal is for them to be at or above their birth weight by the time they're 2 weeks of age. You can also know if your baby is getting enough milk by counting their wet diapers. Up until 6 days old, your baby should have 1 wet diaper for each day of life. After 6 days, your baby should have 6 to 8 wet diapers every day. Baby's stool count will vary, but most breastfed babies have 1 to 4 stools per day. You can also tell by feeling your breast. Once your milk has come in, your breast will likely be full before feeding and softer after the feeding. If they're soft, it's likely that the milk has successfully made its way to your baby. Let's recap. Here's what to remember about establishing your supply. The first 4 to 6 weeks are the most important for establishing supply. Skin to skin promotes a healthy supply and supports your baby's latch. In the early days, baby can't eat much per feeding, so they'll need to eat often. You should feed on demand, which means about 8 to 12 times in a 24-hour period. Cluster feeding is normal. This likely doesn't mean something is wrong with your supply. And finally, whether you need help establishing a good latch or are unsure if your baby is getting enough, contact a lactation consultant or reach out to your baby's healthcare provider. Let's do this feeding thing together.